quickly, please. Oh my god, look at that leg. She is covered in red ants. Oh my god, get it, like, go now. There's been a monkey brought to the front door now. It has been the most chaotic day. I don't know if that's bladder or stomach hanging out. We are not losing you. We are not trying. We are not giving up. This is the moment of truth. These dogs are remarkable. The fact that she's just still wanting a cuddle with her leg bent back on itself. I feel like she fought all the way through the night, lying in that position, covered in those red ants. So now it's our turn to fight for her. These dogs, they just want to survive, man. Good morning! I have woken up to the news that our angel dog, Paprika, who is our office dog, she's three-legged and she's just so divine, has a little scrape on her head. We don't know what from, but obviously she's a VIP, so going straight there to see how I can assist in this emergency rescue. It's not, it's a tiny little scrape on her head, but yeah, we're psycho parents just like everyone else out there, psycho dog parents. It just so happens that I have 3 million dogs to be a psycho dog parent about. Ah, right, let's look at you then.
You silly sausage.
Did somebody bite you?
Can I find another one? I'll take that or a monkey.
Let me help you, let me help you. Oh my god, so hot. Did you say?
Just working. Good girl. Oh, she's so great. Oh, she's such a good girl. She is so great. Oh, she's so good. She's so good. Good girl. Good girl. Oh, she's such a good bean. Oh, good girl.
Right, you're just gonna have to stay inside.
Yeah, we'll stay in. She's like, yeah, I'll go for a nap now.
Yeah. Right, that'll do. No more troublemaking, please.
And then knocking his shoulder.
No more troublemaking.
She's like, me?
Can you come and say thank you to me? Come and say thank you to me. Come and say thank you to me. Okay, perhaps just don't go outside. Oh my god.
Oh.
Thanks, Liz. God, it is bloody roasting today. That was a bit of a trauma with Paprika. I am sweaty. And now I'm just going to drive to the hospital. Oh, get this AC on me right now. It's only 2 minutes away, so I'm pretty sure the car will still be like an oven by the time I get there, but trying my best to get some of this air on me, warm air. And now I'm off to the hospital to make my surgical plan. Every time I say I'm only going into the hospital for 10 minutes, something happens. And we've just had an urgent call come through. We just got a call about a dog that's been hit by a car, so I'm gonna go and see what that's all about. So much for only being here for 10 minutes. Woo! So in the ambulance, just on my way to pick up an RTA. So that means road traffic accident. We get a lot of those here in Sri Lanka. Whilst this patient doesn't look critical, its leg looks horrible. It is at some very, very weird angles. So can't wait to get there, give some pain relief, and then transport the poor thing back to our hospital where we can do the rest of the treatment.
Pictures, I don't know.
Which one?
Ah, here, under the thing.
Oh, we've got loads of fine ants on it.
Oh my god. Oh, darling. Hi, baby. Oh, God, we have to help you quickly.
She seems nice, doesn't she?
Let's see. Hi, Mama. Oh, baby. Yeah, she's going to be fine.
Hey, sweetie.
So we've just arrived at our patient and she is covered in red ants, which hurts so much when they bite you. I've never seen this. It's really, really weird. I don't know how long she's been lying here. This would indicate quite a long time. Let's get these bloody things off you.
She's poppet.
Let's get these bloody things off you. It's great. Sorry, darling. Let's get them off. Let's get them off. Let's watch your feet, Inez. Okay, darling. I think now's the movement. Come on. Let's have you. That's it. Come on, Yunka. I might just go straight to the ambulance. Actually, need it.
I'll just get the last bits so
Yeah.
I'll get with you.
And just the corner as well, Inez.
Sorry, Bubba, I don't want to touch your legs. Sorry, poppet.
Oh my god, look at that leg.
She says the ambulance is that way.
Yeah, we shall go straight there.
I'll just get the bed.
Oh, thanks, Dad. What a good girl you are. A few of these ants with us. I thought I was going to get got. Right, Lysol seems to be working.
Is it? Do you remember? Hey, Mama. You okay? Well, you've got them in your mouth. That's nice.
Yeah.
Oh, Baba, you're trying to get them out.
Right, that leg.
Give us a pain relief. Oh, pop it. She has got a chip.
Yeah. Chaz, can you call the hospital and tell them that's the chip number? So this dog is microchipped, which means that she's been neutered by us, she's been vaccinated by us. So we've checked the microchip number, we've sent it ahead to the hospital, so by the time we get there, her file will be up and ready for me to read, so I'll be able to know when she was neutered, when she was microchipped, if she had any abnormalities at that time, and whether she's been to our hospital before. I don't think so, but she's a real sweetie, so I think she might recognise us. And the sweating is real in here, very real. So we're just working to stabilise her. She's really quite flat. The road traffic accident was actually yesterday. She was hit by a motorbike. So just hoping we don't have any underlying concerns. I feel as though if there was anything super major, she wouldn't still be with us. So that's always a positive. Abdomen feels okay, collar is good. Blood pressure's a little bit on the low side, so we're just going to get some fluids into her, and really importantly, lots of pain relief, and get her on the road to the hospital. So I know I bang on about this all the time, but Sri Lankan street dogs are so resilient. Look at the state of this. The fact that she's just still wanting a cuddle, still being completely amenable to treatment with her leg bent back on itself. It's just, these dogs are remarkable, absolutely remarkable. Let's rock and roll. Let's go. So we're just working on stabilising this little one. We're calling ahead to the hospital to let them know what we found and what we need for when we arrive. We definitely need x-ray. Of course we can see what's going on. I don't think this leg is savable, but we do want to check that all of the other legs are okay, and her spine and pelvis, before we proceed to what looks to be potentially an amputation. Right, my love.
I'll go and check x-rays ready.
Thank you.
It's okay. We're trying to do a million things at once here, aren't we?
Okay, so this is bent back, but I'm just going to see if I can reposition. The answer is no, but I bet with a bit of anaesthetic we can. Maybe we can save the leg. Let's see. I'm just scanning Flower Moon, had to think what we'd called her then, checking she isn't bleeding anywhere, but she does have some fluid in her abdomen. It's not a huge pocket at the moment, so it might be from when she was rolled by the bike yesterday and had a bleed at that point, but not actively bleeding now. But I'm just checking we don't have any further pockets that are concerning. What's your plan to do, Mrs.? It's just a bit sus.
Yeah.
But yeah, it's nice to use that one.
Yeah, it is very small, isn't it? And it is very
Weird shape.
there's some fluid there as well.
Yeah. So Flower Moon is nicely in her kennel. The aim of the next kind of, well, however long it takes, is to try and get her nice and stable so that we can then hopefully move to anaesthetizing her and reducing the fracture and assessing what we can do about the fluid that's in her abdomen. I'm really worried about it. The aim at the moment and the priority is just making sure that she is nice and stable. So that means stabilizing blood pressure, temperature, keeping her nice and comfy, because we can go into shock at this point in time. Once she is nice and stable, I'm then going to look to anesthetize her so we can reduce that fracture and work on a plan for what we do with the fluid that's in her abdomen. So yeah, we've got to give her a little bit of time, a little bit of patience, and then we'll make a plan from there. Right, there's been a monkey brought to the front door now.
Hey, sweetie. Oh, pop it.
It's alright, we'll lift him.
It's alright, baby.
Right. You go this end so you don't get put in, and we're going to slide the bed under. 1, 2, 3.
I know, baby. I'm sorry.
Pull that right down if you can. And we'll use that as a blanket.
Not natural. That's alright, baby.
You're alright. It's okay. It's fine. We'll get an IV in you. The monkey is with us because he was hit by a motorbike, and the driver of that motorbike scooped him straight up and brought him straight here. Unfortunately, he is displaying quite severe signs of a traumatic brain injury, so he's hit his head. Ultimately, when we see monkeys at WECare, it's often because they are very, very ill, because if they weren't, you wouldn't be able to handle them. So we're treating, we're trying to stabilise, we're hoping we can get on top of the brain injury. We have done it many times before. Things do look quite severe at the moment. And in the meantime, we have managed to stabilise Flower Moon as much as we possibly can anyway. So I'm planning some imaging now to see what's going on with her, what the damage is, and where we go from here. Ah, this is good. I mean, terrible but good.
It's clean break, isn't it?
If we can get it reduced, that is excellent. We've just done a quick x-ray of this little girl's leg. We've called her Flower Moon, which is a lovely name. We have a Poya day tomorrow, which in Sri Lanka is, when it's a full moon, we have what we call a Poya, which is supposed to be a religious day, but really it's just a day off work for everyone. So the whole country gets the day off work on Poya. Not us, of course, we're the mugs, because we work in veterinary, so we're all here. But I might have jumped the gun saying this is definitely an amputation. It does look as though it's quite a clean break, so we might, it's a big might, but we might be able to reduce this under anaesthesia and splint it and save this leg. But let's see, it's a big might at the moment. Right, ready. It's crunchy. Let's see. I think what we'll do is we'll just quickly try and x-ray that, make sure it's in position, and then we'll splint it. Okay. So this is the moment of truth. I have reduced the fracture. It was a bit of a... and now we're going to see how well it's aligned before we set it in place. Hopefully we've got good acquisition. Let's see.
The leg x-ray. Did they say the leg is just under?
Ooh, that's nice.
That is, well done.
I couldn't even recognise that was the wrong leg. So we haven't got total acquisition, but
Well done.
better than no leg. Let's see, might not heal. We might have too much damage. But let's see. Right, so just pull the toes with quite a lot of traction and as straight as you can. That's it, yeah, lovely angle. Thank you. Right. And we'll just go straight. Was it in place? Okay. I'm worried about her pelvis now, it doesn't look good. Come on, little dog. Do us proud.
It's gonna be fine.
Be positive. X-ray. Okay. This is the moment of truth. Just x-rayed the pelvis and that is not looking good at all. Quite anxious that we have multiple issues going on here. We do have a bladder rupture, we know that, which does usually imply that we've had some kind of trauma at the back end as well, some kind of impact.
So we want to
Pop that back in.
Colleges in this. What's wrong with all the months?
Oh my god, get it, like go now. We've just had an emergency called in from Mutts. There is a dog there that looks as though it's got its bladder on the outside. I don't know if it's been involved in an RTA or it's been a dog bite, but we have to get down there right now. Right, let's go. Okay, yeah, I'm here. Right, that is gnarly as fuck.
You're thinking bladder. I saw red. In places there shouldn't be red.
Yeah.
Fun.
Fun day.
You're not allowed in it.
Fun day. Cheers to that gate.
To the sides.
Right, let's go.
Oh, it's throwing up quite a lot of blood.
We will just go.
Yeah.
Thanks, guys. Well done, everyone. Well done, guys. Anyone know what happened?
No, don't.
Huh?
Don't fight them.
With who?
We don't know.
Okay, thank you. Head first. I've got him. No. Right, we've got. Okay. Stand moving. Okay. Let's go.
You're okay.
Slow driving, chairs. Let's go. Quickly, please. Good boy.
Good lads.
Well done.
You've got your ear too.
Good boy.
Oh, don't do that. Okay. Don't do that, darling. It's okay.
It's all right.
No, it's all okay.
It's okay. Right. So we've just picked up this dog that is, of course, super critical. Guts hanging out. But back at the hospital, we have another patient who's about to go into theatre. Super critical. Needs to be in there now. We've got some difficult decisions to make. The other patient has a fractured pelvis, a dislocated hip, a fractured front leg, and a ruptured bladder. So really at this stage we have to decide who is the most likely to survive out of these two, and it's a really shit place to be when you have to make that decision, honestly. Yeah, we'll see what happens when I get there. We need to walk straight through to prep, no obstructions, doors please. Watch that on that. Really steady. This is when it puts her down. 0.3 mg per kg of meth IM he's had. He's got 2 IVs in. We need to just have him doing that shopper. We've just had him on open at the moment. I do think we should just knock him straight out personally.
That's
He's got, I don't know if that's bladder or stomach hanging out and guts as well.
Just 2 seconds, can I take a heart rate, please?
He has vomited blood, which would make a little bit of sense, I think. Heart rate's what,
130, I'm setting it from temperature. Sorry, go.
If we had a thermometer, that is.
Give it a minute. Yeah, we're all right. We're all right. We've got him now. Right, we're just going to remove him, Marie, so just give us a sec.
1, 2, 3, list.
Yeah, let's go. Lovely job, well done.
And then back to your side or?
No, we're going to
dorsal.
stay. Yeah, sorry.
Can move it, but fucking.
Right, that's all I needed to know. Let's get the rubber mat off and soak it in Virkon for as long as possible. Yeah. Well done, guys. This is great teamwork.
I can't believe how resilient dogs are. He was just
Mental,
walking
isn't it?
around like it was nothing. Can you imagine if that happened to a human?
I can't.
Yeah, literally, you wouldn't get the end of it.
I cannot. Thank you. Thanks, Rita. This is great.
Was it seen?
Lasta, could you just check in, ask Shanice if the hip is back in and let me know. If the hip is back in. Thank you.
Just bring it down.
Okay, thank you.
It is back on though.
Just doing it.
The process.
So if we're gonna do, I think we need to do this one first.
Well,
I've
asked Francis to get the consult room table work on. We can move that into there. We can operate side by side. We've got 2 anaesthetic machines. Not ideal, but
I'm monitoring on score on one of them.
no, we have enough nurses. We've got 2 anaesthetic. We'll just be theatre, 2 surgeries going on at the same time.
Okay.
Not ideal, but if we have to. Jesus Christ. Bring it, put it in a plastic bag and bring it. We need to see what that is. Thank you. So we're all hands on deck here at the moment. We're managing the little boy that just came in with guts hanging out, and we're managing an RTA from this morning, Flower Moon, who isn't looking good. But I've made the decision that we're going to give her a go. I feel like everyone behind me doesn't agree. But we're going to give it a little go. We don't have room to operate on both of them at the same time, so we're improvising. We're bringing a table through from another room into theatre. We're going to have 2 dogs in theatre at the same time. We're bringing the anaesthetic machine through from X-ray. It's all go here. Everyone is pulling their weight. Everyone is working hard. It's amazing to see us all hustling and trying to save these 2 lives. So fingers crossed, by tonight, we're going to have 2 live animals. Flower Moon, not sure how it's going to go. I feel like she fought all the way through the night, lying in that position, covered in those red ants. So now it's our turn to fight for her. Does that leave everyone out here covered, patients-wise? Is Haritha okay? Do you know what I mean?
Yeah.
Or can we be in and out?
Yeah, do you need that one as well?
And that needs organising, so we can all leave on time. Right, let's have a little look at this. So this is what came from the ground at Mutt's. Our assistant at the cafe said that he was throwing this up and she feels like it's organs. So I just want to have a look. On first glance, it looks like rice. To me, it looks like bloody rice, but let's have a look.
Want me to keep it on 5 mils for keep for the moment? Yeah, I don't want to.
We can, to be fair, you guys can go in first if you're almost ready and we can follow.
Okay.
Are you almost ready or not really?
I think so. I think we're pretty much there.
Yeah, so maybe you move and then we follow through. Yeah, go to the back table. Yeah. Okay, so what do we have in here? Yeah, there is bits of momentum in here.
Really?
A lot of rice.
So would that be his momentum?
Maybe he's just eaten it while it's been hanging out.
And then, yeah.
Groomed himself. Yeah, that's a bit of momentum. It's something that lives inside the abdomen that is now on the outside on this boy. I think probably he's chewed this off. He's gone to groom himself, chewed this off, and then vomited it up, as opposed to this coming straight from the stomach, from any damage to the stomach. So that's the theory. Lovely bit of momentum mixed in with a bit of carrot. We see it all at WECare. So I'm just taking a minute before we go into surgery. It has been the most chaotic day. We have seen many emergencies, made many difficult decisions. And I've probably made the stupidest one right at the end there, which is to go into theatre with Flower Moon. Let's see if my stupid decision pays off.
We've never done this in the history of WECare.
There's the ureters. Right, let's try that, Shalace, and see what happens, please. So I'm doing Flower Moon's surgery. I'm just locating the big hole in her bladder, stitching that up, and flushing the abdomen out, whilst the other team are working on putting Happy's stomach right back into the place that it's supposed to be in, and also closing up a wound that we've found on the stomach, which we're presuming is from a dog bite. So I'm just finishing closing the bladder, and now we're just going to do what we call a leak test. So we're going to inject some fluid into the bladder and see how it expands, see if the closure that I've done seals the bladder enough so that there's going to be no urine leaking out. I'm cautiously hopeful that Flower Moon's bladder repair is holding well and that we're no longer seeing urine leakage into the abdomen.
Just one thing.
Yeah.
Oh, nice.
It's not functioning. Oh, it's really moist. It's straight on my leg.
So come on guys, you can do it. Cheering you on.
While the team finish up Happy's surgery, getting her stomach back into the right place, Flower Moon's got a urinary catheter in and we'll be monitoring her closely over the next few days.
Do you want IV?
I will go IV. Hey darling, this is nice, only 10 minutes after you woke up. Are you okay? Are you still a bit trippy? I'm not sure. So Happy is not all that happy right now. He has just come out of surgery. What time are we on? 20 to 10. You had an eventful afternoon, didn't you? He's a very lovely boy normally, but he's not so happy right now. His surgery went to plan. It was, incredibly complex. His stomach had come out through a hole in his body wall that was created from a dog fight. Really can't believe we managed to get him to the hospital and onto the table in time, and hopefully you're going to have a lovely recovery, aren't you? Tripping balls at the moment, but we're just so happy he's with us. And it's been, so far, a successful day because Flower Moon also made it off the table. We're just warming her up at the moment. She's taken a little bit more time to come around than this grumpy old boy. So big day at work, coming home at 10:30. Yeah, all worth it for the dog eyes. I just got home from a big day at the hospital. You can see I'm just reclining, just trying to rest up. It's 11 p.m. and I'm still buzzing actually. It was the most mental day. So being in surgery until about an hour ago, and just these cases, they're just wild. Like, they're so sad, but at the same time so inspiring and thrilling, dare I say. Like, I don't know if I'm an absolute freak just loving trauma. I just feel so sad for these animals, but that just gives me this like firecracker up my arse that just means I go and go and go all day, and we find solutions even when there are none. But I'm just like, no, you have fought all night. She was hit by a car yesterday and she lay there covered in red ants, just couldn't move until we got to her. And I just think, if you can do that, then I can give this a crack. So yeah, these animals just inspire me so much, just to go that little bit of an extra mile. I don't know if I'm going to live to regret that. I think pretty much all the team disagreed with my take on that one. I am pushing my luck, but Sri Lankan dogs are just so resilient. And Happy, the other dog we went to pick up, just standing in the middle of mutts with his guts hanging out, standing there, letting me put a lead on him. I could have literally walked him to the ambulance on the lead if I'd, it's with his stomach on the outside. Absolutely mental. And these dogs, they just want to survive, man. They're forces of nature. It's really perplexing for me on every level, because any other dog would be dead. Stomach on the outside, standing in the middle of a cafe, dripping blood everywhere, eating their momentum. It just wouldn't happen. But here we are, just like, oh, another day at WECare. You know, in between that, we saw a monkey that had been hit by a car. It's just been a mental day. But it also just fires me up. It really fires me up to be like, no, we are not losing you. We are not trying. We are not giving up. So yeah, I feel tired, really tired, exhausted. But I also just feel so invigorated and like, I love my job. I just love my job. And I really hope these guys pull through. I'm going to be keeping my phone on loud all night, because I've got one of my colleagues is staying over and she'll alert me if anything changes. But yeah, I can't explain the feeling of living that this gives me. That, you know, we're out there, we're making a difference. This is not easy. It's not easy on the body. It's definitely not easy on the emotions. But we're willing to take it. We're taking it smack bang in the face every single day for the dogs. And I wouldn't change it for the world. I love her. You can't go anywhere, can you?
Make sure you check out next week's video for an update on Flower Moon and Happy.
Which could be life-threatening news. I just need to clear my head. It's been a rough day.
And if you'd like to support the work we do, please give this video a thumbs up and subscribe to the channel. There's also a donation link in the description if you'd like to help us keep treating street dogs here in Sri Lanka. Thanks so much, guys.